Hi, everybody, and welcome to this week's session of Soul's Code. So I am here with my co-host, Lorilet Monegro, and we are diving into a few things that we think are pretty important. So we were talking about obligations to clients, and I don't want anybody to get the wrong impression. As people that are in the healthcare practice, we have a responsibility to never do harm to a patient. So to always push for their best possible outcomes. And if we feel that we can't be part of it, then it is our responsibility to refer them to someone else because we can't help everyone. Some people are out of our wheel well of expertise, or they really require dual properties that really encompass the total wellness of this person. So whether they have mental issues or physical issues or speech, whatever it is, well, often they need something else. So as a nurse, I do work with a multidisciplinary team, but a lot of times I'm in the field because I do a lot of outreach in the community. And I do find situations where the people that I'm sent in to help are really not getting the resources they need to really obtain the quality help, and that I do have to refer them to other services. So, what is your experience with that?
Yeah, thank you for that. I find that that is something that is true. Sometimes we have people that come to us, right? And they're seeking help and maybe the help that they need is not necessarily something that we can meet completely. And I find that I end up having to refer to other people. For example, a mom may come and ask me about the child's speech and language issues, but as I'm doing an evaluation, I may notice other things. And I would say, hey, have you considered having your child go for, let's say, a neuropsych evaluation or a neurological workup? Because I'm seeing other things that no matter how much I target in speech, to help your child sound better when they're speaking, there might be a neurological involvement and they may not even know it. And it has happened to me where I have to tell them, hey, I want you to look further into other supports. It's our duty to do that. I mean, some people try to take it on and think that they can solve things and just take on a subject matter that is not even their domain. I try not to touch any of that because one, it would be really unethical. That's the number one thing because I'm not a neurologist, for example, or I am not an occupational therapist. I am not a physical therapy therapist. While I can implement any guidance that I may be given, if it's something that's doable in a speech session, really the best thing is to refer them out. Um, Not always do parents take that well either, right? But we have to do our part, you know.
I had an experience where a child was getting a feed. So I am a nutritionist, even though I was there for a nurse. And it just didn't make sense to me because the child was on so many orthotics and very gassy all the time. And when I looked at the feeding, the child was getting like 6 grams of salt a day, and he
Mhm.
has heart issues. So I said, well, this doesn't work. I said, the maximum daily dose, I said, that used to be 4, they moved it down to 3. Now they're trying to say to keep it under 2. So you have to stay within your wheel well sometimes. Like sometimes you need to open your mouth. And I said, do you have this woman's number? Because I need her to rationalize why this kid's getting 4 times the daily dose of salt intake with heart issues, because it's just not appropriate, right? So, and I did have that conversation with her, and the child was moved off of that by a doctor because she wasn't. Sometimes when you approach people about their line of work and you feel there's an issue in there, sometimes people don't always take constructive criticism.
They don't.
And, you know, that's my job, to advocate for the patient. So it sometimes they might not like what I say, but I do have to question it because I won't follow an order that I'm not okay with. If I feel that it's going to do harm to that person, because I have a failure to do harm to that's part of my moral compass. That's what I signed up for. So I did reach out to the doctor and he said, "You're absolutely right." And he was actually hospitalized right after that, and that was part of what led to that hospitalization. So, but I mean, I didn't have control over that. I can only help what I see when I see it, right? So, um, but needless to say, he's not on that nutrition anymore. So,
Well, yeah, I mean, I think this is also a critical point. When we get new clients, one of our duties is to review what that recommendations have been in the past, what a past evaluation found, and whether those make sense with the here and now and what you have in front of you. Because we also conduct our own initial baselining, at least I do, when I meet a new client, even if they come with a packet of all kinds of evaluations and recommendations. I do my own baselining to really get at where we're at right now, because maybe that evaluation or all the paperwork might be 6 months old, even though it's not super old. People change. I don't know. In 6 months' time, something could have happened. You might have gone away, and now you're more chatty or less chatty.
it
Or
might have been the comfortability with the assessor too. So I take what I see with a grain of salt, and I do my own assessment from there, because I've had women come back from the hospital with prostrate issues, and I'm like, really? This woman has a prostrate issue? Hello, can we change this? Because I'm
mm,
pretty sure she
well,
doesn't have this
to have a
problem.
yeah,
So you have to really dive deeper, and you have to be okay. Like, some people are going to be nasty, some people are not going to take your questions well. I questioned the doctor about a medical order, and the child was allergic to something that he ordered. And I said, "I'm sorry, I can't give it. He has a known allergy." And he said, "Well, um, only IV." I said, "Well, then it needs to specify that on his record that he can take oral of the same medication." I said, "Because it's the same composition, and I
right,
can't willfully give this."
right. I mean, to your point, I think that when people become specialists in anything, the tendency to develop a big ego is there, because, of course, you kind of go really deep into a knowledge base and you have acquired skills over the years and practicing and all that. Not to discredit any of that, but I think in that sense, one of the good things to do is always continue to build that competency, not only by learning new things, which is part of our requirements to being in a continuous learning loop, if you will, with our continuing education units. But aside from that, having interdisciplinary meetings when we are wondering about a particular child's or a client's progress, or if the client themselves are showing signs that this is not kind of meeting their
The
needs,
needs.
we need to kind of have those kinds of moments where we back off and be like, wait a minute, is this really serving the client the best? Or do we need to kind of stop right here, reassess where we're at, and determine new goals and also a new direction for maybe the team? Because maybe this may be happening not only for your little small area. If you start having conversations with others, maybe they open up when we put the client front and center. Then the egos might uh be lowered, if you will, and people are more willing to go back to the basics of why we're in rehab, why we're in any kind of helping field. It's to help someone who needs the help. Um, but it is very easy for people's egos to get bruised. I think that this is also one of the issues that stops people and groups and teams from collaborating. Um,
I've
you know,
had
the
really great
egos.
I've had really great experiences. Most of the doctors that I've worked with in the past, I've worked with for long periods of time, but in the field it's different, you know. So um when you're in a facility, you do develop relationships with those doctors and you do build trust because they see your efficacy on a day-to-day basis, or they interact with you, and a lot of them encourage you to ask questions. So at least the doctors I've worked with, but there are always those one or two where they're ego based instead of patient based, and it really is more of more of finding a nice way to say what
Mm-hmm.
you want to say, so that because you're not trying to irritate them, but you are trying to get the best. And sometimes you do have to remind them that this is about the patient. It's not really about what you feel, because I'm not here to serve you. I'm
Right.
here. I'm here to serve the patient. And I'm sorry. I think they could do better in a better situation. Um, there was a time. I mean, it literally broke my heart that there was a child that just really wasn't getting the PT, the OT, or anything he could. And at 11 years old, the
Oh,
child
wow.
could not walk downstairs. He just didn't have the dexterity. And I said, well, what's going on here? So I had to go after the social worker to say, shame on you. Did she like it? No. But she probably wouldn't be my advocate in the future. But she did understand my reason for questioning it. And at the end of the day, I did the best for the child because I did get that for that child. And I did get him to a place where he's getting what he's supposed to be getting, right? Because
Right.
he can't speak for himself. No one's
Right.
advocating for this child. So somebody has to do that. And the family felt like they were at a loss and that they weren't being heard. And so that's part of our role, to advocate for them, you know.
Absolutely. The advocacy piece is huge. And, to that point, one of the ways that I assist, if you will, in that process is by, you know, having conversations with the parents and then kind of like giving them sample scenarios in conversation of how they might approach the situation, because unfortunately I must say parents aren't necessarily too aware of how to navigate, right, the questions that would come, how to support what they are trying to get supported with, or services that they're seeking out, or additional measures. And it's not because it's is not substantiated, but rather because they really don't know. They don't know that they could actually say these things or request these things. And it's at the child's loss when we do not advocate for what the child needs. And this is important. I think that,
But
our role
the
is not
parents
to be
suffer too.
gatekeepers. Yeah.
So I think the parents suffer too, because a lot of times the burden comes on the parent to take on the responsibility for the services they're not getting. And
Mhm.
and that does cause difficulty within the family setting, right? The family interactions, because the parent becomes overwhelmed, or the child feels overwhelmed because he can't really do the things that he feels like. There's a certain frustration going on there, and it's not with the child, it's with the system. So
Right.
so I feel like there should be it should be more transparent what children and people are entitled to, so that people should know. There should be more awareness to what people can get. Like there's I can't think of the name that I'm looking for. An ombudsman. Like in every facility, there's an ombudsman's number on the wall, right? But usually by the elevator or at the nursing station, where if they're not getting the quality care, or they feel that things aren't copacetic with the arrangements with the hospital, like their needs aren't getting met, that they can call them and they will advocate for them. So
Mhm.
if a patient maybe goes to the nurses station and says, listen, I'm not happy with the level of care my mother's getting, let's say I've come in twice and she's wet every time I come in, or something like that. And the nurse kind of clicks her teeth or gets like, well, we're busy or something like that, or gives her some lame excuse like we're short staffed, because that's certainly not the patient's problem, right?
Mhm.
She can get on the phone and call that ombudsman and say, I'm concerned that my mom's skin might break down, or she might fall getting up to go to the bathroom because every time I come in, she's wet. Can you speak to someone on my behalf? And he will call and he will do that, and he will get a meeting with the family. And if the facility doesn't step up and do what they're supposed to do, then there's other people that come in the state. There's always someone else that you can call at the state or someone else. But I don't feel like there's enough of these things for children.
Well, it's a matter of having the conversations also of the appropriate channels to be able to actually get access to the different kinds of supports that are out there. I think that this is something that, it's not a matter of just, oh, I just shared with the parents. I did a workshop, boom, done, checked off the list. Now, parents, especially who are entering into an educational system that requires more support, such as what is with special education, um, need to be told things in different ways and different times throughout the year. Why? Because this is not something they do on a regular basis. While for people within the educational system, this happens every day as a no brainer. For a parent, this is one more thing to know, one more thing to worry about, one more thing to tackle. And so we have to start creating bridges in those conversations and interactions. And I think that this is probably something across the board. I don't think that everywhere out there people are putting it in plain language and simply accessible. Here's how you access these supports. And I think people sometimes want to talk about the system being strained and the system being whatever, but I'm not too sure that that's really as
True.
accurate.
I
I
don't
don't
think
know
it's
that that's
true.
really that. I don't think that that's what's really happening. I think we have a lot of bureaucracy, a lot of things that are just also papers and papers and papers and papers, but the active part of the doing, I'm not sure how that's being monitored or how that's being quantified or not in the whole special needs Americans with Disabilities Act world. I feel like they create paperwork, 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 but we need more efficiency. um
I think the
you know
paperwork is more of a distractor than anything else. I think that it's created to distract, not to really help. A lot of it. Yes, there has to be documentation. It's not written, it's not done. I get that. But more time needs to be spent from the children. So they're taking away what the children really need. They need that time. A lot of times they're not getting that time from their parents or places because they do have a lot of things that they have to do. A lot of times the therapist, the OT and the PT will actually go in during their educational day to do therapy, you know? So, but I think you made a very interesting point about letting the parents and people know several times, because also the first time you're sitting down to tell them, it's overwhelming.
it is.
They still don't know if they're going to be able to accept this responsibility. It seems very overwhelming. How am I going to deal with a child with disabilities or special needs and things like that? So when you're first approaching them on this, you do need to step back and ask them how they're feeling, how they're coping, and what you can do to make this an easier transition for them, certainly. And do they have any questions? That should really be a question at the end of any of these interactions. Do you have any questions about what we've covered today? Is there something that you need more information on, that I can help you with going forward? because I,
Be-
I think they're afraid to ask too, like sometimes because they don't know they're really entitled to a lot more than they're getting. And these children are kind of pushed through the system sometimes, and or lost in the system sometimes, and that's a shame.
Well, beyond that, I think that parent needs to have in these different types of institutions, whether they be K through 12 organizations, private clinics, or whatever have you, that the city or state or whatever programs are being funded out there, they really need to have clear point of contacts with people. They need to have designated people that they can really talk to. Unfortunately, many times it's like playing chasing games, and parents are, and I say this because I've had parents tell me this, right? Where they go through different issues to get answers of different things, and it's like they're running around. They may write letters, and it happens to be like 2 3 months before they can get anything done, and it's like almost like they're chasing, I don't know, like the Queen of England. I don't know, like they're
I
chasing
know.
some
So
really
it's rough. It's
and it's
rough.
like, why does it have to be this way? I don't understand. So that's why I was talking about bureaucracy and all of these layers that to me make no sense, because it's not like we have 90% of the population requiring these services. So we need to switch and create clarity around, okay, your child has this diagnosis, here's what you need, and make it very smooth so that then we can get things clearly lined up, things clearly
Done.
done, be in compliance with whatever timeliness of things that need to be done. But that requires a rethinking, a reorganization, and a willingness, right? There has to be a willingness from different organizations to say, you know what? We don't have to keep having these parents act like they're beggars chasing around 500,000 people. Why do we have to do that? Why are
I
we doing that?
I
It's
I
a
had a
big question for
patient.
me.
It's crazy sometimes. It really isn't. It can really get you hot under the collar sometimes. I had a patient that she was 16 years old, and she was on a vent and trach and all, and she was very badly contracted. And I never saw a physical therapist or a teacher or an occupational therapist. And she was on my caseload, but I didn't have her all the time. So I asked the mother, I said, does she have services come in, education or anything like that? And she said no. And I was specifically concerned about the PT and the OT because of the contractures. And I said, well, what about for the contractures? I said, contractures are very painful. I said, and they get worse and they're more painful. I remember being in a facility doing rounds and hearing someone scream. I mean, scream. And I went running down the hall because I thought they fell. And she had contractures. It's so bad. And somebody was giving her a shower that the water hurt so bad against, the bones and stuff. And that left such an impression with me. And the mom said, no, they said she's not entitled because she'll never walk. I said, but she will experience pain. And I said, pain is a vital sign. I said, you can fight that. She said, I did. And she said, it was denied again. So I reached out to a therapist that I saw at another site and asked him to call her because I had a discussion with him and he said, you're absolutely right. I don't know how she's slipping through the cracks, but she's entitled. And he said, especially where pain is concerned, because both of her legs are behind her,
Right. But
so
again, that's where also knowledge and skills of the provider comes in, right? In that role of advocacy. We can empower parents to be able to, hey, have you ever thought that your child could use this service because this would actually impact outcomes in so many other ways, right? And we have to be able to know how to uh, share out a process of how this whole world behind the scenes, right? Behind getting a service, there are things that you would have to do as a parent, not only get the evaluation, not only follow through on all of the different components so that paperwork is not missing. Because like anything, there are procedures, right? And so sometimes it may be that a child falls through the cracks. Sometimes it may be that the parent doesn't follow through. Again, that whole counseling piece, the entire process of keeping in contact and being involved, it requires both parts to be connected, not only the parent, but also the organization, right? Because there's some liability on both ends. And,
Definitely,
an
definitely.
organization that doesn't follow through, knowing that a child has an identified need, is just as guilty as the parent who thinks that the need is going to go away because I don't address it, right? We have different components that may be the drivers of outcomes. At the end of the day, for me, it's about okay, where I'm at with a child, what is it that the child needs? If they really need OT, if they need PT, if they need psychological evaluation, counseling, or whatever other related supports, are they getting that? And then have conversations with the parents because I'm dealing with minors, right? Um, and they're the only ones who can really go ahead and, at the end of the day, say yes or say
Follow
no,
up.
you know but again, it's this whole concept of collaborating, putting the client front and center of the decisions as opposed to us making barriers. This whole thing of barriers all over, I personally want to see that be done away with and instead create clear processes. It is my hope that individuals with special needs are able to get the access to the things that support a better lifestyle for them.
Not
And
just
all of
people
us
with
that need to
special
help.
needs, though, but we have to be able to understand our piece in it too. So just because we work an 8 hour day or a 12 hour day, maybe that's not in our wheelway. Well, maybe we're not a physical therapist or an occupational therapist, but that doesn't mean that we don't suggest, request, and follow through, right?
Absolutely.
So if we feel there's a need, I mean, I've worked in facilities and we've had people that decline in ADLs and they immediately go for an evaluation with PT and OT because they're showing a decline, right?
Mhm.
So it needs to be the same in communities and schools. Even if a child is showing a decline in education
Mhm.
or skills relating to his education, if he was doing better a month ago than he is now, what transpired in that
Right.
month and where did this decline come? Is it psychological? Is it something else?
Exactly.
So we need to know our patients and understand their needs, really.
Yeah.
We do have to make them a piece of it because you work with minors, so you do have to ask the adults. But I always ask that child too. What do you
Oh,
need?
absolutely. No.
What's
When
important to you?
Yeah, no, no, absolutely. When a child is able to relate that information, of course, they are even invited to their own IEP meetings and things like that when they're able to do and participate in a way that that they are fully aware of what's transpiring. But I think that one of the key things is us being able to have those conversations in a way that is supportive, not in a accusatory way, and hopefully, it opens a way to have better relationships, work more in unison with any other related providers as well, or even with the parents, that they can then go and get extra help if they need it. um, but again, I think like that whole process of being aware, counseling the parent along the way, right? So that that's not met with resistance, but instead is met of like, oh, I have the best interest for your child, and here are the things that your child needs more support with that is out of my scope of practice. So this is why I urge you to go follow up with this particular discipline or
Or
the other.
even going as far as to do that referral, like if it's a physical therapist or an
Mhm.
occupational therapist, refer them to someone that will put them in touch with the people that
Right.
they need. So like if you know someone in Yonkers and they're in New York and they need someone in New York, but making
Exactly.
that referral to that Yonkers friend who that's their wheel well, so they'll know someone near them, so that they don't get lost in that phone system, right?
Yes,
There's a lot of that going on. It's like a
we
traffic
know.
jam. There's a
We know.
traffic jam there somewhere, and
We
people are
know.
getting lost in that system. And
No.
it's disheartening. It's disheartening, but we just have to keep doing what we do best because we're always advocates, you know.
Yep.
But yeah, we're always advocates, and we learn better ways to advocate as we see more problems.
Yes.
Um, so any last words before we close out
I
today?
I think that, one of the most empowering things that we could do is take action. If we see that a child is having difficulties, or a client rather, because it could be a child, it could be an adult, right? This could be also for adults. Continue to one question what is the issue and where you see things are not working, and request reviews of the current program that the child is in, or the adults, so that then you can advocate for those other support and refer as much as needed, because while we can't solve every problem, we could definitely put people connected with the right individual that can guide them in the different areas.
I agree. I also agree that a lot of parents know their children really well, and that they should not dismiss that information. That sometimes the parent will be the best advocate and say, well, I like the way you do this, but I think my child learns better this way, or this would help my child more. This is where he feels comfortable. Because children usually excel in one area or not. And you had spoke about that in the last meeting, where we want to get those children some wins so
Of
that they
course.
can see their future potential is bright instead of dismal, and they don't feel lost or trapped in that system,
Yes.
so because we want them to have a quality of life.
It's
That
number one. It's number one, when a child or an adult feels valued and they feel they can accomplish things, it develops that sense of self agency. And, we want to foster that as much as possible, because that's what gives people that sense of independence, and the ability to feel that they can belong within the challenges that everyday life can offer for us. At the same times, they are opportunities. So we are the ones who can provide, I'm going to say, the environment. We can contrive environments that help people flourish. And we can do that together. We don't have to do that in a constant, negativity and fight.
it's supposed to be easy and great. So we want to thank you for stopping in and hanging out with us for a little while. As always, to your health, and thanks for coming, guys. And if you have any questions that you feel that we could better serve you in a way where you're looking for resources or people that we can connect you to, or if there's parents out there that would like to be part of this conversation, you are key to these conversations. And we always invite you to come in and be on the show with us and really get into the heart of what you feel your children need, because then we can advocate better for you and serve you better. So have a great day. Good night.
Ciao.